young woman. She's in her mid 30s or 40s, I forget. And you know, we have this lesion in the right kidney. You know, kind of has multiple septations. The septations enhance a little bit. So you know, there's a new Bosniak classifications, not tremendously enhancing. So there's a new Bosniak classification. I looked it up. Like based on the Bosniak classification, this lesion would be probably 2F, based on 2018 criteria. So and these patients usually get followed up. But this is an older case. This is from 2017. So before we had the updated criteria. So any thoughts of what happened? What would you put in the differential, if at all?
I mean, cystic RCC for sure, like you said.
Like a MEST?
So yeah, cystic nephroma or MEST.
Yeah.
Great. Okay, so cool. So you guys are awesome. So I thought it was you know, multilocular cystic nephroma, and they followed this patient for like 3 or 4 years, and it was slowly growing. So they took it out, and the path is, hold on, is, as you guys said, is MEST, mixed epithelial and stromal tumor. MEST, it's basically a low-grade benign lesion, but it really can't be differentiated between, and you can see like that's what they look like, just complex cystic masses. And you really on imaging hard time differentiating them from you know, cystic, multilocular cystic nephromas and cystic RCC. So the final diagnosis requires removal.
It's interesting, those pictures in the from the radiographics article, it almost looked like they had a capsule, whereas yours doesn't look like it has a capsule. Do you know anything about if MESTs have capsules or?
All right, let's see. Let's come back. Sorry.
Or anyone online?
I don't remember that being a specific feature, but I could be wrong.
It does not seem like a word capsule appears in this in the radiographic article, so I assume no.
And do you always have to resect it? I mean, is an ablation an option? I mean, for not the ginormous ones, but like the ones that are smaller.
I mean, again, if it's a 2F, right? It's,
right.
You're supposed to follow it, yeah. Which is what they did, and it was increasing just a little bit. I guess that's why they resected it. But I guess I don't know. Can you ablate cystic lesions? I guess Artie would know better.
They are starting to ablate cystic RCCs. We've even started to ablate, biopsy them. So that is something that's starting, but I think this one is so cystic that, I don't know, I think it's more kind of like, is this benign? And I don't think you would even, I don't know much about if you could even get the diagnosis if you were going to biopsy it. So
Right, no. But
if it's progesterone receptive, it might be like one of these new tumors that could be responsive to some kind of med, if it's like, if we're confident enough on imaging.
Okay.
I don't know.
And then, so with the new Bosniak 2019, how do you differentiate a 2 from a 2F?
Well, I don't have the thing in front. It's based on the number of septations, so, and thickness of septations. So I think it's a few. Okay, don't quote me on the exact numbers because I always have to look it up, and I always have the copy of Bosniak on my desktop. I'm not on my computer right now, so I can't pull it up. But maybe we can do this as one of the lectures at some point because it is a great update. But it's basically the number of septations and or thickness of septations. So the greater number goes to 2F, and I think the greater thickness goes to 2F.
It's like the rule of threes, right? So if it's 3 millimeters in thickness or more, then it becomes 2F, or if it's 3 septations or more, it becomes 2F.
I remember number 4, but again,
I think
I
4,
always have to look it up.
I think there's a 4 becomes, I could be wrong as well, but I think the cutoff 4 is for more than a few, so that becomes I think, or maybe it's a thickness, 4 millimeter thickness, maybe for the thickness of septation.
If you want,
okay, we'll do a Bosniak presentation.
No, I think it's a great I think it would be a great topic, and I can. I mean, if you want, I can quickly bring up an article from the internet. But anyway,
Cool.
We can also